So the Queen's Care Coalition was initially developed this idea that we have all these high utilizing patients. We have patients who are coming into our acute care facility, right? They're coming into our emergency departments for non-emergent needs, for things like a sandwich or a place to rest in the air conditioning or to get social resources. And we also have folks who are getting readmitted to the hospital over and over again for the same chronic conditions. Ultimately, that's not the right care in the right place for this population. And on our health system side, it's a burden on the health system to try to address these chronic needs that ideally should be met in the community. And so we developed this program that would address those needs. And our patient community navigators meet patients at bedside, and they really solicit the barriers to care from the patient's perspective. I think a really key piece is making sure you have good, solid data and that you're constantly updating that data. And so doing things like social determinants of health screenings in all sorts of healthcare settings is invaluable. It makes such a huge impact to get that pulse check on what our population is looking like in Hawaii right now. Where are our needs? And how can we then use that data to better inform how we make policy decisions, how we allocate resources, what communities have the needs, and making sure we're funneling funds and resources to those areas very strategically, using that data rather than sort of this shotgun effect of let's put it all out there and see what sticks. So data is a huge, huge component. Also overrepresented in that population are Native Hawaiians, like for acute care needs and readmission rates, length of stay. We know that there are significant health disparities, right, that folks who are Native Hawaiians experience. And so we do have a very niche part of our Queen's Care Coalition team who focuses specifically on that population and making sure that we're identifying their barriers to care, tearing down those barriers, and doing it in a way that's very culturally mindful and using culture to kind of reconnect people to health. And so that's a really exciting piece of the Queen's Care Coalition that I'm really proud of, our Native Hawaiian team that works with that population.